welfare group 2. Coming from there, obviously here is a big change. I'm pretty sure first class is no. But yeah, so right now we're gonna go through Tricare choices in the United States. All right, so choices. So Tricare is determined by the services, and it's shown in here. So it shows you in here the type of services that you guys have. So your options can change if you move, get married, or status has changed. So i.e. if you retire, then obviously it's gonna change. All right. And let me know if I'm going too quick. Stop me if I'm going too quick, just let y'all know. All right. So sponsor status in regards to the following: active duty, which includes National Guard and Reserve members called or ordered to active services for more than 30 days, separated from service, or retired. So that pretty much explains, sorry about that, this pretty much explains the statuses here. So National Guard and Reserve, qualified non-active duty members of the selected reserve and retired reserve, the sponsor and family members options. So the options they have is Tricare Reserve, Select, Tricare Retired Reserve, and Tricare Young Adult, which we'll get into that as the slides go on.
I want you to pay attention to that 30 days. So every time you see Reserve or National Guard in your bibs, 99% of the time, it's going to be when they're activated for 30 days or more, because that's when they get the active duty benefits that we are get. I think only one time it's 31 days or more.
And you'll probably see that on the test as well. All right, so Tricare choice continue. Active duty sponsors options are Tricare Prime and then Tricare Remote. So all of us in here, we have Tricare Prime, right? So family member options are as follows: Tricare Prime, Tricare Prime Remote, U.S. Family Health Plan, depending on the location, Tricare Select, Tricare Young Adult, Tricare for Life, if entitled to Medicare Part A or Part B. All right. So if you separate without retiring, you'll lose the Tricare Prime, obviously. And your family will lose the eligibility also. However, you may qualify for a period of continued coverage under the following: Transitional Assistant Management Program or Continued Healthcare Benefits Program. All right? You got time to write it down, so some of y'all writing it down.
To make it make sense, basically, once you get out, you're not under Tricare anymore, unless you're retired, and then you're falling into that Tricare retired category. So they give you up to 6 months to get your shit figured out, get your job established, get settled into that new healthcare. So you have at least a stopgap right there of 6 months of coverage until you get your personal stuff set up on the outside.
All right, so retiree options. So you got Tricare Prime, U.S. Family Health Plan, Tricare Select, and Tricare for Life is entitled to Medicare Part A, Part B. Young adult family member options are the same as the sponsor, while adding Tricare Young Adult. And as time go on, I'll let y'all know what I remember being on the test. So a lot of the questions on the test you'll see throughout the ranks. So I know I've seen some of the questions from like E5 or the E6 exam. So some of them are recycled. So as time go on, I'll let you know what I remember seeing on the test. So obviously Tricare Prime, like I said, it's for all of us, active duty here. Also for retirees, family members, and certain others. So pretty much what this is saying right here, as far as your care, so it's being managed by your primary care provider. And sometimes your primary care provider is often predetermined. Now you can change it if you want to. Tricare Prime Remote option is for active duty service members living, working in a remote location. So outside the PSA, which is your prime service area, and their family members. So if you work somewhere where like you're away from like the main population, this is what it's for.
It's usually 50 miles is the number you're looking for Tricare Prime Remote.
It's 100.
Is it 100?
Yep.
100?
It says if you live
Because it's
within
usually 50 miles or 100 hour or a 1 hour drive. Interesting.
Yep. So to get Tricare Prime, you must live in obviously a Prime service area. If you live within 100 miles of an available PCM and waive your drive time access standards. All right, active duty service members must use Tricare Prime or Tricare Prime Remote. So there are 3 options to enroll in Tricare Prime program. So right here you can see the website right here. It says call your regional contractor, submit a Tricare Prime enrollment, disenrollment, and primary manager change form, which is the DD form 2876. And then it gives you a website right here, tricare.mil/form website. You can find the form. All right, so your PCM may be at a military hospital or clinic, a civilian Tricare network provider, or primary care provider is under the U.S. Family Health Plan. So active duty service members, active duty family members, and transitional survivors, surviving spouses, which is the surviving spouses during the first 3 years, and surviving dependent children have no enrollment cost. All right. So active duty service members have no out-of-pocket costs for covered health care services from a PCM or with appropriate referral and prior authorizations. Active duty family members have no out-of-pocket costs for covered health care services from a network provider in their enrolled Tricare region or with an appropriate referral and prior authorization. And this is the point of service right here. Hold on. So point of service option allows the non-active duty service members to any Tricare authorized provider without a referral. And then at the bottom, so it's saying you may pay more money to get non-emergency care from any Tricare authorized providers without a referral. All right, this goes into Tricare Select. So Tricare, this is for Tricare eligible beneficiaries who aren't able to or choose not to enroll in Tricare Prime options and who aren't entitled to Medicare, with the exception of active duty family members. This program lets you manage your own health care and get care from any Tricare authorized provider without referral. And it says active duty providers may not use this option because we're already in Prime.
So I was going to answer that thing earlier about the 100 miles and 50 miles because I'm looking at how it's referencing it. So for Tricare Prime for the 100 miles, it's for specialty care. If you're within 100 miles from PCM, you can get reimbursed for Tricare. Tricare Prime Remote is still assigned for those and their family members who are typically within 50 miles or an hour's drive away from the nearest MTF. Right? So for instance, in Virginia, there's AP Hill, where they have no medical facility nearby. So then they're on Tricare Prime Remote to where then they use Dahlgren Clinic that's over there as their care for their people.
You said 15 miles or 1 hour drive?
Yep, for Tricare Prime Remote. The 100 miles is if they have specialty care for Tricare Prime. If they're within 100 miles of that, their PCM, they then get entitled to reimbursement.
And I've seen that on the test.
So who would probably use Tricare Select?
So Tricare Select is like if you want to pick up your own provider that's not your PCM and you're really bougie, I'm just going to say bougie, you're bougie about it to where you want somebody specific, you're taking the risk of paying more out-of-pocket costs. They can only charge you up to 15%, which is what Tricare, that's what the instruction says. They only charge you 50% more of what you would pay with Tricare Prime. but that's just you're going to pay more out of pocket for it.
Cool. And these are the three options to enroll in Tricare Select. So you see up here, you have the website right here. Again, call your regional contractor or submit a DD form 3043. And the website again, tricare.mil/forms.
But as you see, it's not even an option for active duty for Tricare Select. It's only going to be for your dependents if they want extra care or want their own insurance.
Alright, so receiving care through Tricare Select, you can get care from any Tricare authorized network provider with a referral or prior authorization in most situations. So you will have lower out-of-pocket costs if you use a Tricare authorized network provider versus a Tricare authorized non-network provider. If you choose a non-network or a non-authorized non-network provider, you will not be reimbursed for Tricare. So if you try to use that, you're not gonna be reimbursed. So you're gonna lose money. And then Tricare costs, you pay a yearly deductible per visit, co-payments, or cost shares. Non-participating non-network providers may charge up to 15% above the Tricare allowable amount. So either way, you get in charge if you try to use this, which again, we can't use it. So this really applies to your family members, your dependents.
Remember, that says above, too. So Tricare is already having you pay a certain amount where you only pay some partial of it. That's saying that they can charge you even 15% more above that using a non-network provider.
So submit claims to the regional contractor for your area where you live. In the U.S. and the U.S. territories, claims must be filed within 1 year of the date of the service or date of inpatient discharge. I've seen that on the test. I've seen this where they ask this part right here, claims must be filed within 1 year. All good?
You guys know you can search your Tricare providers through MilConnect, correct? Too, right? So when you go on there and try to change your beneficiaries, it'll list all those beneficiaries within the mile radius of where you are to know who's already under Tricare.
All right, so if your provider isn't Tricare authorized but wants to see Tricare patients, tell your provider he or she can do so without signing a contract with your regional contractor. So it says most providers with a valid professional license, which means issued by a state or a qualified accreditation organization, can become Tricare authorized, and then Tricare will pay them for covered services. All right. All right, so for Reserve Select and Reserve Retired Reserve, the premium, it's premium based. Worldwide healthcare plans for certain qualified selected reserve or retired reserve members, their family members, and survivors. All right, so you have to enroll. Enrollment is required. An initial 2-month premium payment is due when you enroll. So keep that in mind.
That one's been on the test before. I said that one's been on the test before on how much you're paying ahead of time for Tricare Select.
Okay. Monthly premiums, a yearly deductible, and co-payments or cost shares apply. Get care from any Tricare authorized provider without a referral. Certain services require prior authorization. And it says note, when you are National Guard or Reserve sponsor, when your National Guard or Reserve sponsor is activated for more than 30 days, this coverage stops while you get the active duty benefits.
And you have to restart it.
Yep. Mm-hmm.
See that 30-day rule? Like I said, anything for reservists, literally what they're entitled to changes the minute that 30-day mark is passed. So you'll see that in dental or just any kind of medical in general.
Alright. So Tricare for life, so this goes on Tricare for life. If you're entitled to Medicare Part A, you generally must have Medicare Part B to keep Tricare, regardless of your age or where you live. This is requirement based on federal law with an exception for active duty service members and active duty family members. If you're eligible for Tricare and have Medicare Part A and Part B, you're automatically covered by Tricare for life. If you're eligible for both Tricare for Life and U.S. Department of Veterans Affairs benefits and choose to use your Tricare for Life benefit for healthcare not related to service-connected injuries or illnesses, you will pay more to see a VA provider. Right. Tricare will only pay up to 20% of the Tricare allowable amount for care you get at a VA facility, and you may be responsible for the remaining amount.
So to make that make sense, so I just came from Great Lakes. A lot of the beneficiaries that go there, they can get seen at the VA hospital. A lot of them are retirees, so they are entitled to both Tricare for Life and VA. It just depends on which one they want to use for whatever injury they're treating at that moment. But you just run the risk, as it says on here, paying more of up to 20% if you're using that VA compared to the Tricare insurance plan.
All right, so it goes into Tricare Young Adult. So it is premium-based health care for qualified people who have aged out of Tricare. So it includes medical and pharmacy benefits, but not dental coverage, right? This part right here, with the age, hint, I've seen this on the test as well. So this part, you may generally purchase Tricare Young Adult coverage if you are dependent of a Tricare eligible sponsor, unmarried, at least age 21 but not yet 26. That age amount is on the test.
So an easy way to remember it, because a lot of times this is for like kids that are in school that still live at home with their parents. At most, somebody would be spending time in college or whatever else for 8 years. Say they want to be a doctor, 8 years, right? So that 18 to 26 time frame is saying, hey, I'm going to college, I can't pay for something out in town, whatever else, I'm living with my parents. I now have up to the age of 26 to still be falling under their medical coverage until I get out and get on my own. I don't think the full-time students thing has to be guaranteed. I know there's some considerations there. It's not covered completely on here. It might be one of them, but they have to fall into a certain category. Definitely unmarried, but full-time student might be another requirement for that.
Is that all the sponsors still active duty or retiree then? For the 21 to 26?
You said if the sponsor's still active duty?
Yeah, would the sponsors still be active duty?
Yes.
Okay. What if they're retired? Do they still qualify for that or no?
I don't know. I feel like they might because they're then falling in another bracket. They're not falling under Tricare Prime. They're falling under the Tricare Retired or Tricare for Life.
I feel like they might because that's like an actual federal thing, like outside of the military. Like 26 is a federal thing. A civilian as well, so I think it might still be.
This part in red right here, I've seen on the exam. So Transitional Assistance Management Program, which is TAMP. So it offers 180 days of premium health care after your sponsor separates from the military. Again, I've seen that on the exam.
So that was the one I was mentioning. They give you up to 108 days or 6 months until you establish your new health care with your new work or wherever you're at.
And it starts the day after the service member separates from the service. And this is the Continued Health Care Benefits Program. So it's premium-based health care program managed by Humana Military. So though not a Tricare program, the Continued Health Care Benefits Program offers continued health care coverage 18 to 36 months after the Tricare coverage ends. Certain former spouses who haven't remarried before the age of 55 may qualify for an unlimited duration of coverage. If you qualify, you can purchase the Continued Health Care Benefits Program coverage within 60 days of lost TRICARE, or TAMP coverage, whichever is later.
So I wanted to hit on this slide because this is something that you guys should know knowledge-wise. Whoever gets married, and I don't want to wish it on anybody, but say you get divorced. Say you divorce your person and you've been married for 10 years or more. If that person never remarries, they continue to get your health care coverage and part of your retirement. So know that when you're marrying your spouse and you divorce, based off of the time frame that you are together, they then can fall into that and say, hey, I don't ever want to get married. And now you are covering their health care for all those years. That's why it says here, haven't been remarried, and they still get that duration of coverage.
So what he said is true. Also keep in mind too. So let's say like if you get, this is a side note. Let's say if you get you got married, you got divorced, you got remarried, but then you didn't update. What is it? Your Red DA, right?
Mm-hmm.
You didn't update your Red DA, right? So let's say if you pass away, guess what? The person that you divorced gets your benefits.
Your new spouse doesn't.
Yep.
Well, and to mention that, because I don't think y'all know this, I hope you do. It's not just your Red DA. They go off of MillConnect, right? So you might update your percentages in Red DA, but if you don't go into MillConnect and update it the same way, they don't have somebody identified, and they might go by your default, and it might have been your spouse, who's your ex-spouse now. So you have to make sure it is reflected in both systems, because they're going to pull all that from MillConnect under your beneficiaries tab on who they're giving that money to.
Yep. I've seen that plenty of times with people that get married, they don't update the system, pass away, and then they exit with the benefits. So that's something to keep in mind. All right, so the Tricare Pharmacy Program. So provides prescription drugs through military pharmacies, Tricare Pharmacy Home Delivery, and Tricare Retail Network Pharmacies and non-network pharmacies. And then the options are right here. So the option is as follows. Military pharmacies, no cost for up to a 90-day supply of most drugs, usually don't carry tier 3 drugs. Tricare Pharmacy Home Delivery, which is no cost for active duty service members, co-payments for non-active duty service members, up to a 90-day supply of tier 1 and tier 2 and tier 3 drugs. And the drugs are mailed to you with free standard shipping.
I want you to kind of make a note on this slide, because when we go over chapter 21, P117, some things might be different, and you need to know which manual they're talking about based off the question. So that's the stuff that's going to confuse you. If they're talking about Tricare Pharmacy, or they're talking about your chapter 21 pharmacy of the P117. Because some of the numbers are different in those two chapters.
All right, so Tricare Retail Network Pharmacies, so they pay one co-payment for each 30-day supply, no need to file a claim, located in the United States, in the United States territories of Guam, the Northern Mariana Islands, Puerto Rico, and the U.S. Virgin Islands. And for non-network pharmacies, pay full price and file a claim to get the money back. The amount of money you get back depends on the deductible, out-of-network costs, shares, and co-payments. And then these are the tier of drugs. So tier 1, widely available and lowest out-of-pocket costs. Tier 2, generally available and higher out-of-pocket costs. Tier 3 may have limited availability and highest out-of-pocket costs.
Don't mix up your tiers of drugs compared to your classes of drugs, or schedules of drugs.
Yeah.
They're two different things.
And then for the dental options, so it offers 3 dental. Good? Can you go back? Not sure. All right. So the options offer 3 dental options that are separate from Tricare health care options. And then these are the 3. So Tricare active duty dental program, Tricare dental program, Tricare retiree dental program. And this is for active duty service members generally. Active duty service members generally get care at military dental clinics, but may sometimes use the active duty dental program.
So to make that make sense, a lot of dental facilities don't have specialty services like ortho or maxillofacial surgery. So a lot of those dental services will be ADDP'd out just to a local dental area, obviously Tricare covered, so they can get those services.
And then the options continue. So Tricare active duty dental program applies to active duty service members and National Guard and Reserve members called or ordered to active services for more than 30 days. So see how it goes back to the 30-day thing that he was talking about? All right, and it applies to active duty service members, National Guard and Reserve members, and their family members, individual ready reserve members, and their family members and survivors. Tricare retiree dental program applies to retired service members and their eligible family members, retired National Guard and Reserve members and their eligible family members, certain survivors, and Medal of Honor recipients and their immediate family members and survivors.
That's a lot.
Questions?
When was that last updated?
Which one? The Tricare? Shoot. I mean, it's been since I've been in. I've only been in 11 years. So somewhere, I think probably the last 4 or 5 years, Tricare choices in the U.S. just got updated. I don't know the exact year off the top of my head. I don't know. They pick and choose when they want to update stuff. Just like we have the QA instruction that's still from 1989 and still hasn't been updated.
Is it a fear?
Yep, that one manual too. You can tell by the way those manuals are written.
Shit, I had to go through it back in the 90s.
Yeah,
That's the only instruction they got.
it's fucking crazy. You would think something like QA would be updated by now. But no, they're going to do the OpNav 5100 17 times. That one's been updated at least 3 or 4 times since I've been in. Are we on Tricare Maternity?
Hey, good afternoon, everybody. My name is Echemon Jean-Louis, and I'm here. We'll be going over Tricare Maternity with the maternity program, right? This slide is pretty straightforward. There's not a whole lot of information. I'm not here to teach you guys about the in and out of Tricare Maternity. I'm just here to get you guys ready for September. All right. A lot of this is gonna be up to you guys to truly read this instruction and those pamphlets and go over some of the stuff that you need to know. But I will show you guys what I have learned, what I have seen on the exam, multiple times I've taken it, and hopefully wish you guys nothing but the best. Okay. It's 7 slides. It's pretty quick, pretty easy, and we'll just go ahead and go through it. After the slides are over, there are a few information that's not on the slide. I want to go ahead and want you guys to write it down so that way you guys can be familiar with it. Okay, it's mostly dates and percentage. All right. Everybody here familiar with the maternity instruction, right? Yes, no, maybe. All right, please read that.
6,000
That's
Delta.
very important, okay. For the maternity program, right? Medical services related to conception and prenatal care, postpartum care, generally for 6 weeks after delivery. Treatment of any complication. Just like everything in the Navy, there's always an exception, right? So these are the things that they cover. Alright. Prenatal care starts as soon as you get pregnant. Okay? Those are some of the services that they provided. Amniocentesis, everybody know what that is? Alright. Shorter censuses. Shorter synthesis. Everybody know what that is? What's the other name for that one?
Chordocentesis? I don't know.
You don't know? Okay. The other, don't worry, I did a job for y'all. And got make sure I wrote it down. It's PUGS. Percutaneous umbilical cord sampling. That's the other name for it. If you see shorter synthesis, that's the other name for it, okay? Everybody know what chorionics villus sampling? CVS? I know what that is. What's the other name for it? Nah, it's alright, it's okay. CVB, that's the biopsy. When they do the biopsy for a pregnant person. And of course, the fetal stress test and electronic fetal monitoring, okay? Those are the stuff that they cover, especially if you're high risk pregnancy. Again, this is pretty straightforward and direct, okay? They will perform ultrasound just to go ahead and look to make sure the baby is healthy and the mother is healthy. Everybody is good to go.
I did want to say on that first slide, just because this is what's going to be the most important about this instruction, Tricare covers all medically necessary pregnancy care. That's literally what's going to be on the test. Anything is medically necessary. So if you're reading some sort of procedure they're getting and it's not necessary for the health of the baby or the mother, it's not going to be something that they cover.
And of course, I know I'll go over it after the slides are over. They will not cover any ultrasound for routine screening or determine the sex of the baby. I know now it's a new thing. Everybody want to know the sex. Hey, if they didn't tell you or you don't believe what the provider said, tell you, you want to do your own thing, you're gonna come out of pocket for it.
They do cover it.
No, we're not covering maternal ultrasound for routine screening.
They're talking about like those 3D ultrasounds that some
Oh,
people can get.
No,
No.
That's why I say if you don't believe what the provider tell you, but if you want anything extra, hey, you're gonna have to come out of pocket for it. All this fancy stuff you want, remember, military grade, the most basic stuff. That's what you get. All right. No, I mean it sounds funny, but it's the
If you want to be bougie, you're going to pay extra
yeah.
to be bougie.
If you want to be bougie, hey, go ahead and get that 3D, but you're gonna pay 3D money. Go ahead. All right. Labor and delivery, they cover again. Medical, this is what you need to ensure that you have a healthy baby and the mother is healthy as well. Okay. They will cover C-section if needed. If you go ahead and say, nah, I don't want to go ahead and, hey, you may be responsible depending on where you're at, especially for those that decide to go out of town without an OB referral. A lot of times Tricare are pretty picky about that. If there is no referral and you go out of town to do your own thing, do it fancy other hospital. All right. What else is next? Everybody there are different type of plan for Tricare. Please familiarize yourself with that because one of the things that I'm going to go over is which ones cover what. All right. The left of the hospital is 48 for vaginal and 96 for C-section. 2 days, 4 days. All right. The care received after the baby is born, minimum 2 postpartum are authorized. More can be authorized if there are complications or if your provider after you give birth feel like, hey, we need more follow-up exam on this patient. We need them to come more often. That's it. All right, cool. Those are all the slides. Okay, like I said, this is pretty cut and dry, right? I know he was just going over CDHCP. I think as far as what are some of the Tricare plans there are, right? Tricare Prime, for maternity, right? Tricare Prime. Your primary care manager with maternity care services, okay, will provide maternity care for you, okay? Tricare Prime Remote, good to go. And I know we talk about they will charge you a percentage that you will have to come out of pocket, right? Does anybody know what that percentage is?
15%.
If you go out of town, what's the maximum they can charge?
15%
15%.
above.
Anything 15% and above, you're gonna have to pay the difference. All right, just remember that 15% and above for non-provider affiliated. It's gonna be 15% and above. How many days do you have if you are here in the U.S. to enroll the baby within Tricare after giving birth?
So it's different the instruction and what the hospital puts out. It's different the instruction and what the hospital puts out.
Okay, so I'm glad you say that. For advancement purposes, I know you guys probably heard that nonsense the whole time. Y'all been in core school, right? Just go by what's on the paper, okay? Do not try to confuse yourself. If they are here in the U.S., it's within 90 days. Go ahead and get them right. Overseas, you get up to 120 days, okay? That's what you were trying to.
Yeah, they put at the hospital that it needs to be done for 60 days, and then they drop coverage. So
Nah. So they got not they got it's.
So
It-
basically,
I
what
thought
he's
it
trying to
was
say is
60
if we for
in the
testing
Tricare
purposes,
manual.
just go off
Yeah.
what the instruction
Yeah.
says. I know you said that the hospital.
And 90 does not sound right.
Obviously, you taking an exam.
Pretty sure it's 60.
It's 90 days.
What the instruction says.
All right. So yes, the hospital can, again, policies can be stricter depending on where they are. But however, they say 60 days. They will drop you. It's to give them 30 days buffer. But it's 90 days if you're here in the U.S. Overseas, it's 120 days.
What
Okay?
Tricare do they move to if you don't get them within that time frame? Tricare standard. So you'll have to pay more out of pocket until you get them in Tricare Prime.
Do we need to know that?
Tricare, that one's been on the test. What happens when your care, if you don't get it within that period, what are they enrolled into? And Tricare Standard is the answer for that.
So, okay. And for those overseas, of course, remember, Tricare overseas will be covering you down for about 120 days. Last but not least, I know we talk, dental is not part of it, but for Tricare dental, during pregnancy, a third clinic is covered for, in the 12-month period. Please remember that, all right? Tricare, for pregnant people, right? For those that are pregnant, there's a, you know how you're supposed to get 2 clinics, right? A third one will be covered in the 12-month period. All right, as long as within that 12-month period, you get an extra one. That's the Navy way of saying, hey, thank you. All right. Any questions? Like I said, this was straightforward. Like I don't like to bore you guys. I want to go ahead and take any more of your time. I just want to go ahead and give you guys a nugget that you need to go ahead and be successful out there. Short, straight to the point, easy day. Remember, 50% is what? If you go to a non-provider that's non-affiliated provider, 50% above, you will come out of pocket for it. 90 days for what? I know what all enrollment where. Yeah, enrollment for if you're within the continental U.S. How about 120 days? There you go. Easy day. All right. What's your question?
It's kind of like hypothetical. Like I know a lot of the major hospitals, like their labor and delivery, they refer people out. So if that happens, do they do like some of the extra stuff? Like does Tricare cover that bill?
Yeah. So if you get a referral, yes, they will cover you as long as you get a referral. But if you go out of town, if you go out and do anything on your own, then you walk in the slippery slope right there. Like they really don't have to. You know what I'm saying? That's just being honest. Because you got all these services within all the MTF you guys work at. But if you go out of town, I cannot say that they will say yay or nay.
It depends on how they fill it out.
Yep.
Yeah.
It's caveats on the services that they give you. So you can get approved for a provider out in town for maternity care that is under the normal stuff they cover. But if you are out there and then you all of a sudden say, I want to get a 3D ultrasound,
Yeah.
Tricare will not cover that, right? It goes upon the services, right? That's why I said not medically necessary, you'll be paying out of pocket. That's why even the C-section one, right? If it is not recommended you're supposed to have a C-section and you say, go ahead and say, hey, I still want to have one, because it's not medically necessary, you're still going to pay out of pocket for that.
If it's not in writing, go ahead and pay for it. That's what they tell you. If we didn't go ahead and say yay, you're gonna pay for it. You got money, go ahead, we're gonna take some of that. All right. Any other questions? Concerns? All right, thank you guys for your time. Hey, good luck. I'll probably see you guys again. I think I got one more topic. We'll talk about nutrition in a couple of days.
To answer your question, May 2022 was Tricare in the U.S. update. So it was very recent.
Yeah, so the difference between the 60 and 90 is.
Nice to meet you.
I'll come and help you out.
Thanks, man.
So if you don't do it, they'll drop them.